So the focus of our research is on looking at how we can better support the case reporting process using information and communication technologies. So health providers and health systems are putting in electronic health records to support documentation of clinical practice, billing purposes, and of course providing better care to their patients. And public health has an opportunity to take advantage of that infrastructure that's being developed to improve traditional case reporting, which has largely been paper-based forms that providers have to fill out and mail in or fax in to the health department. So in our research, what we're doing is we're sort of identifying notifiable disease cases as they're reported by the laboratory electronically, which has been around for a decade, and using that as a way to prompt providers to send in their portion of the case reporting process documentation to the health department. And largely we're doing this by pre-populating what the providers need to report to public health and trying to support that workflow as well. So supporting the clinical workflow to pass information in a very timely way to public health agencies. So that's the purpose of our research, is to sort of build that and trial that in practice. And I think what we've known to date is we know that providers have a hard time remembering to report things to public health, and when they fill things out, providing incomplete documentation, which requires callbacks from the health departments, lots of phone tags with clinics to get the information that public health needs to document that case of reportable disease, and then report it up the chain to the state health department and then on to CDC. And so what we're trying to do is support that using information and communication technologies, and understand more if we give them this kind of support, will providers take advantage of that support and improve their documentation completeness, timeliness, so on and so forth to public health. So that's the purpose of our research, and we really don't know beyond that they tend not to send reports in. We don't really know too much more about the reporting process, so part of the research is learning more about the reporting process and what additional things providers need and health departments, what they need in order to improve their internal workflows as well as they capture this data, log it and document it, and move it up the chain in public health. So I think what will be added to the PHSSR field by this research is a more understanding around workflows on both the clinical side and the public health side when it comes to disease reporting or broadly capturing information from routine healthcare delivery, and in order to use those data for public health purposes. So a large gap exists now in sort of our understanding of how do we best sort of tap into electronic health record systems, how do we best tap into data documentation on the clinical side, and then use that on the public health side. And that's largely what this project can inform on the PHSSR side, is what do those clinical workflows need in order to be efficient in capturing the data that public health needs, and how do we structure the public health workflows to best tap into those available resources and then use those data efficiently to support public health work processes. All right, so one of the implications for this research when it comes to public health practice, as well as policy, is the real need for public health to be at the table when we're having discussions around the adoption and the use of electronic health record systems. To date, a lot of the meaningful use programs, a lot of the incentive dollars have largely been driven by the Centers for Medicaid and Medicare Services, and they've been driven for the purposes of improving clinical documentation and support for payer-based systems and reimbursement in healthcare. They largely have not been driven to support public health practice. And so there's a real need to have public health at the table because there's so much opportunity to tap into EHR systems. But what we've learned is that the clinics are very, very micro-focused on doing exactly what they need to do for the meaningful use incentive program and for EHR adoption for clinical purposes, and they often don't think about the public health implications. In their hearts, they want to do what's right for public health, but they just don't have the time to do additional documentation. So public health needs to be at the table to, one, understand and listen to what providers need and how we can better support their clinical workflows without burdening them, and on the other hand, understand and advocate for particular types of data to be collected that we need on the public health side, with the ultimate goal of sort of capturing it once as care is being delivered and then reusing it multiple times for billing, for clinical improvement and record review, and for public health practice. One of the implications for this research for public health research is the need to better understand the context in which data are captured. So if we're going to, on the public health side, tap into electronic health records to reuse those data for our purposes, we need to understand the context in which they were collected in the first place when we're trying to interpret their meaning. So we need to understand that the way that certain diagnostic codes are entered into the record is largely for billing purposes or to justify doing procedures and tests and things, and not necessarily automatically assume that it's because a patient has a particular disease or has a particular severity of disease. So we have to think very carefully about that from the research side. The other thing that context helps us to understand is the quality of the data. So the data are fit for the use for the clinicians because they're the ones entering it and then using it. And so it's not necessarily always fit for our needs. So we need to think carefully about whether our needs are necessarily justified or how our needs differ from those of the clinic when we're going to reuse those data. Because we may have to live with somewhat incomplete but timely data, or very incomplete but not so timely data, and adjust our either processes on the practice side or on the research side, be willing to wait a little bit in order to have a more complete record before we can do our analysis.